The Ben Simmons injury story just became a lot more interesting after Steve Nash stated that Simmons underwent an epidural to try and help manage his back pain. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. We got some new reporting today that Ben Simmons has been dealing with specifically some irritation of his L4, L5 disc of his lower spine, hoping that he can return for a couple of regular season games before the playoffs. But then we also saw that Simmons underwent an epidural injection, which is a steroid injection into the low back to try to help treat his pain. The question everybody's been asking is what in the world is going on with Simmons' back pain, with some people trying to suggest that maybe he's faking this or this is not some real injury. So now is this proof that he truly has been injured here since we've heard about this injection? Unfortunately, I still don't think it's that black and white. First of all, we have to understand that most low back pain is very non-specific. Generally, we can classify it as either being myofascial, meaning it's all of the different muscles of the low back, some of those that are being strained or being irritated. But there are tons of different layers of muscles as we go down into the lumbar spine. There are a lot of different superficial layers, deep. Everything I'm removing here are individual specific muscles until we get all the way down to the bones and the nerves in the spinal cord. So initially when we heard about this general back soreness, things sounded very non-specific. We would have suspected more just muscle irritation, maybe some muscle soreness, but not necessarily a specific injury. There's a difference between having just some general soreness for maybe some irritation of muscles or some stress on some muscles and having a true like acute or chronic injury, meaning a specific pathology, a damaged tendon, a damaged nerve, a damaged bone that we can point to as saying this is injured. So now does the news about this steroid injection to help with pain relief in his back mean that there is in fact some specific injury? An epidural is an injection with some cortisone or a steroid that's placed into somewhere around the nerves or into the spinal column to try to help decrease inflammation to help control pain coming from the back. Looking at our biodigital anatomy tool here again, what I've got highlighted in between the bones are the discs of the spine. They're these sort of cushioning things that sit between the bones to help provide some space there and to help provide some cushion to that axial load. On the backside of all those, of course, we have the spinal cord, the nerves running down through that channel with the nerve roots exiting out these little foramen or these holes in the side of the spinal cord to go onto the muscles, to go on to control sensation. Typically when we're doing an epidural, it's because there's some sort of disc injury that's caused pinching or irritation of one of these nerves. On this isolated image here, we can see that disc and there's some material that's kind of herniated out of that disc. That material is irritating, it pinches on that nerve root and causes pain to typically travel down the leg and can affect muscle strength and sensation. This is more of like what it sounded like Draymond Green was dealing with, a pinched nerve, meaning a specific kind of true injury from something that changed in the back. Epidurals can either be done where they go transforaminal, meaning they kind of come in and they go right into this space by that nerve root, or they can be done between the lamina, kind of coming more in this way to get into sort of the center of the spinal canal. There's different reasons to do each of these injections, but those are the two approaches that are generally taken. So now you might be thinking, well, this means Ben Simmons must have a nerve issue in his back. Well, unfortunately, from the wording of things, it still is not that clear. This was Ramona Shelburne earlier talking about this injury.
Well, you know, he was progressing in that rehab from the back injury. And this is a real injury, Perk. I know we were talking about this the other day on set, and you were, what's going on? He has a real injury here, and this is something that he's dealt with over the course of his career. It's flared up.
So first important thing there, this is something he's dealt with over the course of his career. That implies this is something that's probably been present for a long time, as opposed to a specific, like, he was lifting weights, he became acutely injured and suffered a new injury.
And I think the thing that is, there is an optimism that he can come back from. It's not a serious injury. There's no pain down his legs or anything like that. It's nothing like that's involved, but.
Next important point, there's no pain down his leg. Remember, we showed that picture of those nerves being pinched. If those nerves are being pinched, they can radiate and cause pain down the leg, like Draymond Green when he had pain in his calf. So presumably the Nets don't think he has what we call a radiculopathy, meaning impingement of the nerve from the spinal cord. So now let's go back to this earlier report, stating that Ben Simmons has remained sidelined with irritation of the disc. No specific mention of irritation of the nerve, just irritation of the disc. This is where the big unknown and the challenge of medicine comes into play. When we get an MRI, we might see some incidental bulging of the discs or some early signs of degeneration of the discs, but no clear pinching of the nerve that we can point to. In those cases, oftentimes that disc has been a little bit bulged for a chronic period of time. Nothing has like acutely changed. It's chronic stuff that we don't always know exactly how to correlate that with the patient's symptoms. The fact that Simmons has been supposedly dealing with this for a while, has had back problems in the past, to me suggests that this just could be some irritation of literally the disc or some early degeneration of the disc, maybe some small herniation of the disc, but nothing that's like an acute nerve being pinched, which is good news. That's great news. You don't want to have an acute nerve injury in the lower back. But the challenge is that there's not necessarily a 100% clear-cut way to manage that, like there might be if you had a pinched nerve. We call this discogenic pain, and it can be extremely difficult to manage with the combination of medications, physical therapy, rest, and things like injections. The fact that it's gone this long before they've done the injection suggests that initially they hope they could get it under good control with rehab, but now they're saying, well, we're still not good enough yet. Let's try the epidural to see if we can calm down some irritation from the disc. But without having a clear pinched nerve or nerve injury or thing you can specifically point to, it's less reliable, the outcome that you see with doing these epidurals. And remember how I said at the beginning that a lot of low back pain is very nonspecific. So people will hurt, and then we get an MRI scan where we see some things that might look a little bit abnormal, but it's hard to correlate those exactly with the specific symptoms. This is, again, that art of medicine. It's certainly possible this is just some general back soreness with some irritation, some wear on the muscles and the tendons, but there's a little bit of evidence of some disc injury on imaging, and so they try an epidural to see if that calms down the pain. But this isn't as straightforward as having something like a torn meniscus where you can go in, sew it back up, know that that's the problem, and then move forward. So circling back, that's where it's hard to really know if we can classify this as a new injury or just Simmons maybe has had some disc irritation all along, and the question now is whether or not that's truly symptomatic. The epidural is done in an effort to try to help control some of that irritation, reduce some of that inflammation, but this isn't like a clear-cut, obvious black and white slam dunk sort of a thing to do, as already evidenced by how challenging his rehab and recovery has been. Generally speaking, epidurals are going to take some time to kick in, and so this isn't like an overnight thing. But remember, Simmons is still going to have to progress his activity. He's supposedly not even running yet, and so he's got a lot more to build back up. And so I think it is hopeful to get back by the end of the regular season, but it's definitely going to be tight. The other question is, if this epidural isn't effective, then what are you doing? You're still kind of stuck back at square one, trying to do the rehab, trying to strengthen the muscles around the back to hopefully get it feeling better. There's no doubt to me that Simmons is having pain. I don't think he's making this up. The challenge is what that pain is truly coming from and how our treatments can appropriately help based on what we're seeing and how that might correlate with the exam. Back pain is challenging, and it sounds like, again, this is not a straightforward thing. It's great news to hear that he doesn't have pain going down his legs or clinical signs of a pinched nerve in his back, but it's less optimistic, seeming that things have kind of been chronic. He's had this before and maybe aren't as specific or focal with the treatment. That's it for the video, everybody. Let me know, as always, any questions or comments down below. And until next time, we'll see you later. Bye.